Thanks, Scott. The Affordable Care Act will live another day, maybe even years. At the last minute, President Trump pulled the bill to change what's widely known as Obamacare because it didn't have enough votes to pass. No Democrats were voting for it, and a group of conservative Republicans didn't think it went far enough. President Trump is moving on.
I think we have to let Obamacare go its way for a little while, and we'll see how things go. I'd love to see it do well, but it can't. It can't.
Politics aside, what does this mean for the average American, especially those of us who live here in Florida and Georgia? And to help us answer this is Dr. Carolyn McClanahan of Life Planning Partners.
Thank you.
Thanks so much for being with us this morning.
My pleasure as always.
You know, you get the sense that a lot of lawmakers find it too complicated to figure out, so how are the average people supposed to figure it out? Yep. President Trump is talking about Obamacare or the Affordable Care Act eventually failing. Is that something that we should be worried about here in Florida and Georgia?
Well, the thing is, if they want to make it fail, they can make it fail. And one of the problems that we had with health care reform to begin with is that the Democrats focused on coverage over cost, and costs were concerned to a lot of people, and so was coverage. The GOP attacked it from a cost over coverage standpoint, which means, and the way they attacked it, though, is just cut things off the top, which would have hurt a lot of people. Now, what they should have done is focused on fixing the system, and which would have helped control the costs. The ACA can work if they want to make it work. It had a lot of good things about it, a lot of things that need to be fixed, and so they can choose to continue to make it go down a bad path, or they can actually start fixing and repairing the system.
A lot of Republicans had concerns that it was backloaded, that the cost would be kicking in much, much later, and that it would fail, and that we would end up going to a single payer system, which is exactly opposite what the conservatives want.
Right. Well, that's because when the way the law was written, it actually was written on a lot of Republican principles. You know, this was tried in Massachusetts through Mitt Romney. He's the one that actually started Obamacare, if you think about it. And had it been implemented well, it had a lot of good Republican things in it. Like the individual mandate actually started as a Republican idea. And so they can choose to go ahead and make it work along Republican principles that will allow free market systems to operate. It won't be totally free market, but most of us that are in the whole healthcare debate realize there needs to be public and private partnerships to make healthcare work.
And you bring up the magic words, free market, because the Republicans who kept this from coming to a vote, the Freedom Caucus, they want a strictly free market enterprise for health care. I mean, do you ever see the two meeting in the middle?
Well, you know, the problem with a totally free market plan is it's never been tried anywhere ever. And so that would be a new experiment, I mean, in any country ever. And so I think, you know, ideally you hope the Freedom Caucus would see that there are things, and I actually have proposals that we've worked with in D.C. that where we could provide very cheap care, very good care, inexpensively, if we make it simple. And have a system that's basically a safety net for everybody, not just the poor, and then you can have a free market system on top. So I think there's room for compromise in the future, and we'll get there.
We'll see what happens. Okay. Dr. McClanahan, thanks so much for being with us.
My pleasure as always.
If you know someone who may want to see this interview and didn't get a chance to, you can share it with them later this morning. Just head to the morning show page on news4jax.com.